Sit up in your bed right now. Just sit up. The next time you wake at 4 in the morning with your heart pounding and your mouth dry, do this same thing. Pay attention to what your pulse does in the first 10 seconds. If it shoots up and stays up for nearly a minute before settling, keep watching. Because despite what your cardiologist probably told you, that pounding isn't a heart problem. It's a reflex that stopped working the way it used to. In most people over 50, this is what's called a baroreflex problem. There's a small cluster of pressure sensors in your neck that nobody bothered to teach you about. Their job is to keep your blood pressure smooth when you change position. After 50, they get sluggish. So when you sit up at 4 a.m., your pressure spikes for a moment instead of staying level, and you wake up convinced something is wrong with your heart. I'm not going to make you wait 14 minutes to hear the protocol. The full version comes at the end. But here's the headline so you know what you're working toward. 3 minutes before bed. A specific way of breathing. A simple neck pressure technique. And one rule about how you get out of bed in the morning. That's the centerpiece. The why is what makes it stick, so stay with me. You probably know exactly what I'm about to describe. You wake up sometime between 3 and 5 in the morning. Your heart is going faster than it should be. You can feel it in your throat. You're not having a nightmare, you're not anxious about anything specific. But your body is acting like you just heard a noise downstairs. You lie there for 20 minutes, waiting for it to settle. By the time it does, you're wide awake and the rest of the night is ruined. You mention it at an appointment. They order an EKG, normal. Maybe a Holter monitor for 24 hours, normal. Maybe an echocardiogram, heart fine. Then comes the prescription, usually a low-dose beta blocker, sometimes a sleep aid. You take it for 3 months. The pounding still happens. It's just slightly muffled. And now you're exhausted in the morning and your heart still wakes you at 4 a.m. The cycle just runs. Here's what gets me. A lot of you have started avoiding water after dinner because you think the bathroom trips are causing the wake-ups. They're not. And you're now mildly dehydrated, which makes the baroreflex problem worse, not better. You're solving a different problem than the one you have. That stops tonight. Standard medicine treats early morning palpitations as either a heart rhythm issue or an anxiety issue. For some people, that's exactly right. But for most people over 50 with a structurally normal heart, the doctor has been looking at the wrong system entirely. Before I go further, there are situations where 4 a.m. heart pounding is an emergency and no home protocol applies. Stop the video and call your doctor today if any of these describe you. Your pulse, when you check it, is consistently above 110 beats per minute and irregular. That can be atrial fibrillation. You feel chest pressure or pain along with the pounding, especially radiating to your jaw or left arm. You become short of breath at rest, not just on stairs. You faint or nearly faint when standing up. Or you have a known cardiac history, and this pattern is new in the past 2 weeks. The protocol I'm about to give you doesn't apply to those situations. Please get evaluated. If none of that describes you, if your EKG is clean, your morning palpitations are predictable rather than chaotic, and you don't have chest pain, the next part is for you. Inside the wall of your carotid arteries, just below the angle of your jaw, sit clusters of stretch-sensitive nerve endings. They're called baroreceptors. Their entire job is to measure blood pressure moment by moment. When pressure rises, they tell the brain to slow the heart and relax the vessels. When pressure drops, they tell the heart to beat faster. They keep your blood pressure within a narrow band all day, automatically. Here's what nobody sat you down to explain. After about age 50, 2 things are happening at once. The arteries themselves stiffen, so the same pressure change produces less stretch. And the baroreceptor nerve endings desensitize. They don't fire as quickly. The brainstem response also gets a little slower. The signal still arrives, just late. The result is a feedback loop that used to be smooth and is now jerky. Pressure rises. The reflex catches it late. The heart overcorrects. Pressure overshoots. Your heart bounces between fast and slow until things settle. And this is exactly what's happening at 4 a.m. While you're lying flat through the night, your blood pressure naturally drops. Around the early morning hours, your cortisol rhythm starts ramping up to wake you. Cortisol raises blood pressure. In a younger person, the baroreceptors smoothly absorb that rise and you wake up around 6:30. In someone over 50 with a sluggish baroreflex, the pressure overshoots. and you wake up at 4 a.m. with your heart pounding because your reflex is overcorrecting. The pounding isn't your heart failing. It's your reflex catching up to a change it should have smoothed 2 minutes earlier. Let me tell you about someone I'll call Margaret. 64, former librarian. She came in convinced she was having early heart failure. For a year, she'd been waking at 4 a.m. most nights with a pounding heart. 2 cardiologists, 3 monitors. Heart structurally fine in every test. They put her on a beta blocker. 6 months later, the pounding was muffled. But she was now exhausted in the daytime and had developed cold feet from the medication. Then one day, almost as a side comment, she said, "The strange thing is, when I'm on vacation and I've been walking around all day, the 4 a.m. pounding doesn't happen." That was the clue. Margaret didn't have a heart problem. She had a baroreflex that had gone soft from years of mostly sitting, and the only thing that retrained it was rhythmic standing up and sitting down practice. 6 weeks on the protocol I'm about to give you. By week 2, she was sleeping past 5 a.m. By week 6, the 4 a.m. pounding was gone in 5 out of 7 nights. 2 tests. Right now, while we're talking, the orthostatic test first. Sit on the edge of a chair for 2 minutes. Find your pulse on your wrist or your neck. Count the beats for 15 seconds and multiply by 4. Write that number down. Now stand up. Wait exactly 1 minute. Standing still. Take your pulse again. If your pulse jumped by more than 20 beats per minute and your standing pulse is above 100, that's a sign your circulation is having to work harder than it should. Your baroreflex may be sluggish. Now the deep breath test. Sit down. Take the slowest, deepest breath you can. 5 seconds in, 5 seconds out. Do this 6 times in a row. Notice what your heart rate is doing. In a healthy baroreflex, your heart rate clearly slows on the exhale and rises on the inhale. If it stays flat the whole time, your vagal baroreflex tone is low. Both tests are ones you can repeat in 2 weeks. 3 habits. A lot of people over 50 have without realizing they're sabotaging the baroreflex. Long, uninterrupted sitting. 3 hours of stillness lets the reflex go dormant. The vessels lose their reactive tone. Caffeine after noon. It doesn't just affect sleep. It directly desensitizes the baroreceptors over time. Most people over 50 are still drinking afternoon coffee out of habit, not necessity. And evening alcohol. Even 1 drink. Alcohol blunts the autonomic response for the next 12 hours exactly when you need it most. Now the other side. What actually retrains the baroreflex? Movement transitions. Every hour, stand up from sitting. The reflex is trained by use, like a muscle. Slow-paced breathing. 6 breaths a minute, 10 minutes a day, has measurable effects on baroreflex sensitivity. And cold water on the face. Splash it for 30 seconds. It activates the diving reflex, which directly stimulates the baroreceptors through the trigeminal vagal pathway. Here's the protocol. Every part matters. And I'm giving you a version for people who can move easily and a version for people who can't, because the baroreflex doesn't care about your knees. Morning, before you get out of bed, 45 seconds. While still lying down, do 6 slow-paced breaths. 4 seconds in, 6 seconds out. Then sit up halfway, propped on your elbows, and hold for 10 seconds before sitting fully up. Then sit on the edge of the bed for 20 seconds before standing. We call this a graded orthostasis. It gives the baroreflex 3 small challenges instead of 1 big one. Daytime. Every hour you sit, stand up, count to 10, sit down. That's it. Set a timer. The reflex is trained by transitions, not by exercise intensity. If you can't stand easily, do a seated heel raise. Feet flat, lift heels, hold 5 seconds, lower. The calf squeeze sends a venous return signal to the receptors. Evening, 90 minutes before bed. 3 minutes. This is the heart of the protocol. Sit upright. Place 1 hand flat on your chest, 1 on your belly. Breathe in for 4 seconds through your nose. Let your belly rise, not your chest. Out for 6 seconds through pursed lips. 6 breaths a minute, 3 full minutes. This rate is called the resonance frequency. It's the rate at which the baroreflex receives the strongest training signal. Then, immediately after, splash cold water on your face for 30 seconds. Don't skip this step. Paced breathing followed by cold facial immersion produces a baroreflex training stimulus that paced breathing alone does not. 5 things to do before you go to sleep tonight. 1. Do the orthostatic pulse test now. Write your sitting and standing numbers on a sticky note and stick it to the bathroom mirror. 2. Pick the latest cup of caffeine you currently drink and move it earlier by 2 hours. Just that one shift. 3. Tonight, before bed, do the 3-minute paced breathing, 4 in, 6 out. 6 breaths a minute. 4. Right after, splash cold water on your face for 30 seconds. 5. Tomorrow morning, before your feet hit the floor, do the 3-stage rise. Lying, propped. Edge, then stand. Do this for 2 weeks. Retest the orthostatic pulse on day 14. The number itself will tell you whether to keep going. 2 things before you go. How old are you? Write your age in the comments. Last time I asked, the range went from 52 to 88, and the patterns were different at every decade. And where are you watching from? City, country, time zone. Trinidad, Kenya, Manchester, Manila, Phoenix, Saskatchewan? Write it down. If someone you love wakes at 4 a.m. with their heart pounding and has been told it's anxiety or their heart, send them this video. They've almost certainly been handed a prescription that doesn't reach the real mechanism. You may give them the explanation nobody bothered to give them. Your heart isn't betraying you at 4 a.m. It's a reflex doing its job a half second too late. Train the reflex and the 4 a.m.s go quiet. I'll see you in the next video. Hey, sorry to interrupt for just a few seconds, but I genuinely couldn't keep this to myself. If you're over 50 and you've been feeling like your skin just isn't responding the way it used to, this is exactly what changed everything for me. This is the Age Reset Protocol, a science-backed guide specifically designed to help your skin renew and reset after 30. And trust me, it works even better after 50. It covers everything your dermatologist never tells you, the real reasons your skin ages faster, and the exact steps to slow it down and bring back that glow. And here's the thing, it's only $27. That's less than one serum that probably isn't even working. You can grab it right now through the link in the description and the pinned comment below. The purchase is completely safe, there's no subscription, no commitment, and it comes with a full 60-day money-back guarantee, 0 risk. So go ahead, click that link, and thank you so much in advance for getting it. You will not regret it, I promise. Now let's get back to the video.